comes to shoulders, we're still talking shoulders. You guys can't throw me off. Still talking shoulders. So we're gonna rule in and rule out certain types of issues. Now in the shoulder, this is how I like to chunk it up, right? So we have bone problems, right? So what kind of bone problems can we potentially have? So bone types of problems are fractures, right? So we're gonna, group them into something where you say bones have, you can have fractures. It can be due to trauma, right? You can have bone problems, and it can be due to arthritis, rheumatoid arthritis types of issues, right? So in terms of fractures, and when we're talking about trauma, what is considered fractures in the shoulder? What you want to pay attention to are really kind of common types of issues that can happen, but also common themes. Okay, we know how bone healing works, right? Bone healing, right? We know how it works. So we can kind of figure out certain things when it comes to the bone. So what kind of traumas can essentially happen? You can fall and you could break your humeral head, right? You could have, I still consider this a shoulder, a humeral shaft fracture, right? So that's kind of like in the middle of the arm right here, or you can have it at the head. There's clavicle. Of course, there's scapula as well. But now these are like not as common, right? Clavicle is actually very common, but scapula fracture is very uncommon. But just think about, these are all the three bones that could break. What's another type of fracture? Well, one of them is actually Hill-Sachs, but that's actually a dislocation fracture, right? You can also have a bony Bankart, which is a dislocation fracture as well. I'm writing small so we can fit. But so to list out, think about all the fractures that could potentially happen in the shoulder, right? So it's pretty much the humeral head. It's like, that's where it's going to be. This is going to be pretty common, right? There's different attributes to that, but it's pretty common. And then you have arthritis and rheumatoid arthritis types of problems. So let's look at fractures and think about what bone healing requires. So bone healing generally requires that, not bone healing, not just bone healing, but what happens if you have a fracture, right? So first things first, you have to make it stable. How do you make it stable? Most of the time, it's either immobilization if it's small enough fracture and there's no tendons pulling on that bony part, it's stable, then we can just immobilize for a moment. But if it's unstable, there's multiple pieces, just like in a fall with a humeral head, you're gonna have surgery to stabilize it, right? So then you have to know what kind of surgery that you're having. It's usually some type of fixation, correct? You're having some type of ORIF, there could be some type of pinning, right? Or they could have a total shoulder replacement due to the fact that the fall was so severe, right? So anything could potentially happen there. Now, clinically speaking, once you stabilize something, you are allowed to start, once it's stable, you're allowed to start some kind of motion, right? So what's the point of stabilizing it if you can't move? So you're gonna start doing some type of motion. Usually it's passive range of motion, right? And one of the reasons why it's passive range of motion is because you're just trying to move the joint, but about 4 to 6 weeks, you're gonna have clinical healing. All right, so about 4 to 6 weeks, you're gonna have clinical healing, which allows you to do more motion, more active range of motion, more aggressive passive range of motion, right? So if you kind of lump all this information together, that's gonna help you kind of weed in and weed out certain types of problems that are what you're essentially allowed to do. So then you're also looking at the muscles that are attached. Like if you have a humeral shaft, if you have a humeral shaft fracture, there's not muscles that are attached to that would pull it apart. And so you're allowed to move, right? Once they stabilize that broken part, you're allowed to move. If it's a humeral head fracture and they did an ORAF, you're stable, so you're allowed to move, right? If it was a greater tuberosity fracture, which is, it's just like one like speck off of the humeral head, right? You might not be able to move that because what's attached to it? The rotator cuff muscles are attached there. And so you start doing active range of motion, the muscle's gonna pull on that fractured part, right? So most of the time, they're gonna pin it or they're gonna do something to stabilize that so you can start to move. Now, obviously, when I talk about protocols and what you're allowed to do is just in general, because if you take a look at the chapters in the book, so much of it is dependent on what the surgeons are going to say, more so than others. But you have a generality of, first 4 weeks, you either are going to be able to have limited motion or immobilized. But then after about 4 to 6 weeks, because the bones are healed, then you can start to move it more actively, right? And go beyond like that 90-degree or anything like that. And I'm talking specifically if it's just a fracture, correct? No one would consider other things when it becomes a dislocation or soft tissue injury.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.